She came in with fever. She was very breathless. She wasn't able to feed.
Prompt and effective antibiotic treatment saved this child, suffering from acute pneumonia.
We're happy that we were able to save her, and she can go on just to be like any other normal kid.
Not everyone is so lucky. In many poor regions of Sub-Saharan Africa and South Asia, pneumonia and diarrhea together account for 1/3 of the deaths among children under 5. With the new report, UNICEF officials hope to launch a new global campaign against pneumonia and diarrhea. The campaign will focus on these two preventable illnesses as part of a broader plan to improve the welfare of children worldwide. Holly Newby of UNICEF says that two killer infections have not previously received the public attention they deserve.
Because these are such major killers of children, we have to tackle these in a serious way. It's important to bear one point in mind, though, and that is that unlike some of the other diseases that have risen to prominence, diarrhea and pneumonia are quite complicated to deal with.
The UNICEF report notes that only 1/3 of children diagnosed with pneumonia receive antibiotics. As a result, the respiratory infection kills a child somewhere in the world every minute.
The price of inaction is staggering.
Dr. Oren Levine is Executive Director of the International Vaccine Access Center at Johns Hopkins Bloomberg School of Public Health. He is helping to lead a campaign to distribute pneumococcal and rotavirus vaccines, which Levine says can protect the children throughout the developing world against pneumonia and diarrhea.
But for us, the work has only just begun. And so what we're doing is racing to try and make sure that this vaccine gets out to the children who need it the most as quickly as it can. We hope that by 2015, as many as 50 million kids could be immunized with this vaccine.
UNICEF officials say the campaign will be a complex challenge.
Now is the time to put pneumonia and diarrhea back on the agenda in a serious way.
One of the issues with pneumococcus is that there are 90 different strains of the bacteria.
According to the UNICEF report, prevention and treatment of the two infections will involve similar strategies: increasing the distribution of vaccines and antibiotics, encouraging breastfeeding, expanding access to safe drinking water and sanitation, and disseminating oral rehydration salts to children with diarrhea. Vidushi, Sinha, VOA News, Washington.